I was in my backyard and I started to feel a pain in my stomach area. And so I went inside and I laid down a little bit thinking, well, maybe it'll just go away. And then the pain just got very intense. And all I really remember is just really screaming from the pain in the hospital. Having an abdominal aortic aneurysm is no fun at all. The recovery, they said, would take 6 months, and even to today, definitely not back 100%, never will be, and especially at this age, But if it wasn't for the hospital, I'm sure I wouldn't be alive.
Dennis's life was saved at Gerald Phelps Community Hospital, located 4 hours north of San Francisco in the rural county of Humboldt. He is one of 60 million Americans who rely on rural hospitals for healthcare. Due to the government's ill-devised policies on Medicare and Medi-Cal reimbursements, California's rural hospitals, like all rural hospitals in the U.S., are at risk of closing. So how can you help keep rural hospitals open? Dennis was lucky. He reached the only critical access hospital within 50 miles of his home. Had Gerald Phelps been closed, his life would have been lost. Gerald Phelps Community Hospital is one of 59 rural hospitals in California and 2,000 rural hospitals in the United States. It serves as a hub for delivering high-quality, life-saving healthcare to 10,000 residents that live within its roughly 775 square mile service area. For scale, this is what that same service area would look like in Sacramento, Los Angeles, and Washington, D.C. Unlike the populated areas of Sacramento, LA, and Washington, D.C., the residents of rural Humboldt County, like many other rural Americans, are faced with their own set of unique challenges. Many of the residents live far away from the hospital and there is little public transportation. These residents live on unpaved roads, and some live without phone or internet. Storms coming off the Pacific often close many roads and cause power outages, which can further disrupt these patients' ability to be seen at the hospital. But these challenges are not what is at the root of why rural hospitals are closing. For that, we will need to look at the financial challenges. Many rural hospitals in California, including Gerald Phelps, see a majority of patients who have Medicare and Medi-Cal. 75% of Gerald Phelps patients are covered by government insurance. 45% of its patients are covered by Medi-Cal, which causes a major financial burden due to how Medi-Cal reimburses California hospitals. Medi-Cal reimbursement rates are set by the California Department of Healthcare Services, and while there are some supplemental funding programs, the basic fee-for-service rates have not changed since 2010. That's over 12 years without a fee increase. This is the primary root cause of the financial jeopardy that faces most of America's rural hospitals. More than 150 rural hospitals closed between 2005 and 2019. Another 19 shut down in 2020. 6 more closed in 2021 and 2022. More than 200 are at immediate risk of closure today, and another 600 rural hospitals are at risk of closing in the near future. At Gerald Phelps Community Hospital, our reimbursements for Medi-Cal insured patients went from 29% of service costs in 2018 to 18.5% in 2022. Rural healthcare delivery is not sustainable at these reimbursement rates. In fact, what business or government contractor could sustain receiving reimbursement costs below cost for services? One would not expect a contractor to take a bid to repave roads or maintain infrastructure for less than cost alone. What can you do to keep rural hospitals open? Reach out to your local, state, and federal representatives and ask them to pass legislation that increases funding for rural hospitals so 60 million Americans won't be at risk of losing reliable, local healthcare.